What health psychology actually is and what is not. Before we dive into today's topic, I want to ask you a question. I want you to really think about your morning today. Did you brush your teeth, grab a cup of coffee, or maybe check your phone before even getting out of bed? Why did you do those things? Was it because you felt like it, or is it something deep rooted habit that you don't even think about anymore? Most of us think our health is just about what happens at the physician's office. But the truth is, your health is decided by those tiny decisions you make every single morning. And that, my friends, is exactly what we are talking about today. Today, we are answering the question, what is health psychology?
Are you ready? Let's talk about it.
Welcome to the third episode of Tawana Talk Psychology. I am your host, Tawana, and I am so excited to be on this journey with you. First, let's get a word from our sponsor. This episode was brought to you by Tranquil Horizon Health and Wellness of Central Texas, LLC, along with its hands on simulation program, PsyCSimX.com, an organization committed to advancing psychological education, behavioral health insight, and holistic wellness through behavioral health consulting and coaching. Now, let's focus on the first section. Let's talk about what it is versus what it's not. Now, let's focus on one of my specialties in psychology. A little bit about me. I currently have my Master's of Science and also completing my Doctor of Psychology, PsyD, which one of those specialties happens to be health psychology. But what is health psychology? And actually, what is not health psychology? When I tell people I am talking about psychology, they usually think of a therapist's office, a leather couch, or someone talking about their childhood or deep root trauma that plagues their likelihood of their personal, professional, or individual mental well being. That is clinical psychology. It focuses on treating mental illness, but health psychology is different. It's not about therapy or giving you a diagnosis. In fact, if you remember one thing from today, let it be this. Health psychology focuses on the behavioral and the physical health long before a diagnosis ever happens. Think of it as a type of preventative measure, but from a psychological perspective. We are looking at the why. Why do we know smoking is bad, but some people find it impossible to stop? Why does stress make your stomach hurt or your head throb? Why do some people bounce back from an injury while others struggle? This brings me to my next section, what health psychology is also called and why. Now, here's something important I want to clarify, especially for anyone hearing this term for the first time. Health psychology is also known as medical psychology or behavioral psychology. And those names actually tells you a lot about what this field does. Medical psychology highlights how psychological factors influence medical conditions and physical health. Behavioral emphasizes on the role of behavioral like habits, stress, responses, life choices in disease prevention and health outcomes. This is also different from psychiatry, and that distinction matters. Psychiatry is a medical specialty. Psychiatrists attend medical school, and their primary role is diagnosing mental health conditions and managing them through medical treatment, including medication. Their work focuses heavily on brain chemistry, system management, and medical interventions. Health psychology, or what is also called medical psychology or behavioral psychology, is not medical treatment. We do not prescribe medication. We don't manage psychiatric diagnosis. Instead, Health psychology focuses on how behavioral, stress, lifestyle, and psychological processes influences physical health and illness. We look at how chronic stress affects the heart, how coping styles influence pain, or how habits or beliefs impact recovery and long-term health outcomes. So, while psychiatry treats illness through a medical lens, health psychology works alongside healthcare by addressing the behavioral and psychological factors that shape health before, during, and after medical care. These are different roles, different training, same goal, better health outcomes. Health psychology earned its name because it sits at the intersection of psychology, medicine, and public health. It emerged when researchers and healthcare professionals realized something powerful. You can't fully understand physical health without understanding behavior, stress, emotions, and environment. That's where health psychology lives. Let me give you another real world example, this time related to chronic illness and heart health. Two people can have the same heart condition, the same diagnosis, and even the same medical treatment, and still have a different outcome. Why? Health psychology looks at the questions like, how does chronic stress keep the nervous system in the constant fight or flight state, placing extra strain on the heart? How do anxiety, fear, or health related trauma affects blood pressure and recovery? Why does chronic pain or long term illness often lead to inactivity, disrupted sleep, or emotional exhaustion that then worsen physical symptoms? We also look at what happens after a diagnosis. Living with a chronic illness isn't just physical, it is psychological. The stress of managing medications, lifestyle changes, appointments, and also uncertainty can directly affect pain levels, inflammation, and cardiovascular functioning. So, again, health psychology isn't treating the disease itself, it's addressing the behavioral, emotional, and stress related factors that shape how the disease is experienced and managed. In health psychology, we don't look at the body in isolation. We look at what is called the biopsychosocial model, and this is one of the foundations of health psychology. Now, that sounds like a big academic term, but it simply means this: your health is shaped by the intersection of your body, your mind, and the environment. Let's break that down. First, biological. This includes your genetics, your physical condition, your immune system, and how your body functions on a psychological level. Some people are genetically more vulnerable to things like heart disease, autoimmune conditions, or chronic pain. Biology matters, but it's only one piece of the picture. Second, psychological. This is where thoughts, emotions, stress, coping skills, and belief systems come in. Chronic stress, anxiety, unresolved trauma, or even from how someone perceives their illness can directly influence physical symptoms. This is why stress can increase inflammation, raise blood pressure, or intensify pain or any conditions that you have within your body. The brain and body are in constant communication. Third, let's talk about social. This includes your relationship, work environment, culture, access to resources, social support, isolation, workplace stress, caregiving responsibilities, or cultural expectations around health can all shape how illness is experienced and managed. Social stress is still stress, and the body responds to it the same way. Health psychology looks at how these three pillars interact together, not separately, not in silos, but when one pillar is overwhelmed, the other feels it. This is why health psychology focuses on the whole person long before diagnosis ever happens. and long after it does. Now, in conclusion, where does it shows up? One of the reasons health psychology is often misunderstood is because we do not focus on traditional therapy. You won't find a health psychologist sitting in a private office doing long term talk therapy. Instead, we work inside systems, healthcare, public health, consulting, offices, workplace, and communities where health behaviors are shaped every day. You will find health psychology in medical and hospital settings working alongside physicians, nurses, and care teams. In these spaces, we help patients manage chronic conditions like heart disease, diabetes, chronic pain by addressing stress, coping, adherence, and lifestyle behaviors that directly affect physical outcomes. You will also find health psychologists in public health and community programs. This is where we help design educational campaigns, wellness initiatives, and prevention programs that encourage healthy behaviors. Things like physical activity, stress management, sleep, and medication adherence. The goal is to reduce the illness before it becomes severe and costly. Health psychology also shows up in workplaces and organizations. That's actually what I focus on. Chronic stress and burnout doesn't just affect mental health. They contribute to heart disease, immune dysfunction, and long-term disability. Health psychologists work with organizations to reduce stress exposure, improve work conditions, and support employee well-being before health problems escalate. At its core, health psychology is about prevention, behavioral change, and quality of life. We focus on helping people function better, cope more effectively, and make sustainable changes that protect their health over time. We're not replacing medical care, we're strengthening it by addressing the behavioral and psychological factors that medicine alone can't fix. So, next time you choose a glass of water over soda or decide to take a deep breath instead of snapping when you're stressed, you are practicing health psychology. Thank you for listening to this episode of Tawana Talk Psychology. Remember, health psychology focuses on your behavioral and health long before diagnosis ever happens. Next week, we're going to focus on how stress actually changes your physical body, and you don't want to miss it. Stay curious and stay healthy.